guys, I'm Jonathan.
And I'm Troy.
And we're both leaders with running medicine for the 2018 season. Each week throughout the 2018 season, we'll be putting out videos focused on injury prevention for runners.
These are things you can add into your regular training to be healthy and injury-free for the regular season.
Exactly, Troy. Today's topic will be covering how to tell the difference between when the pain you're feeling is less concerning, such as soreness, minor issues, compared to more concerning pain that can be indicative of overuse injuries, such as joint issues, muscle strains, overuse injuries.
That's right, Jonathan. So less concerning pain typically involves pain that eases while you run. This can be muscle soreness or stiff muscles that loosen up as you warm up and as you loosen those involved muscles.
Yes, sir. The next one is joint pain. So joint pain that eases as you warm up, it doesn't ache or swell after you finish running. Swelling can be a good indicator of when you're working your joints too much. If you have knee injury and you're running on it, you can use this as a good tool to gauge how much training your knee can handle on a given day.
Okay, exactly. I like it. Another sign to look out for is when your muscle pain is generally relieved with rest. This can be indicative of minor or moderate muscle strain, and the pain you may be feeling with this can be your body simply telling you that you need to rest to let these muscles recover some.
The last one is when the pain you experience is not associated with muscle weakness. If you're not feeling muscle pain, but the pain does not decrease strength, that muscle is also not impacting your running form, then this pain or soreness is generally manageable.
All right, so now let's talk about more concerning pain that you may experience, which can be a little more indicative of a potentially more serious injury. This can be pain that increases with activity and does not improve with rest. This includes anything from muscle pain to pain in your joints. And if you're running and you feel pain in your knee and experiencing catching, popping, or your joint is simply starting to feel like it wants to give out, this can be indicative of a more serious issue within the joints, and it may require an evaluation from your physical therapist, who can in turn help you determine the source of the pain and give you an idea of the right course of action from that point forward.
That's right, Troy. So if you're feeling those associated symptoms in your knee, then you could benefit from visiting a physical therapist. When you see them, they can generally evaluate your injury and they can help you determine the cause of the problem, recommend the appropriate treatment, exercise suggestions, and ways that you can change your current training to allow your body to heal.
Okay, so awesome. Now, before we conclude this next episode, we have just a few more points to talk about. On a pain scale of 0 to 10, with 0 being no pain at all and 10 being the worst pain imaginable, irregular pain that exceeds a 3 or a 4 while you're running can be something to be aware of, especially if it's consistent throughout your run. Now, in general, more concerning pain that can be indicative of an injury may typically involve some of the following pain patterns. The pain may increase with activities. The pain does not improve with rest. It involves pain described as shooting, stabbing, or catching, joint giving out, and feeling unstable. It involves muscle weakness. Pain has a specific onset moment. Pain that persists in the same area every time you run. Pain that wakes you up at night. And on the pain scale of 0 to 10, pain that exceeds that 3 consistently while running. And lastly, pain that does not subside within several hours after running.
All right, guys, so this next section doesn't necessarily have to do with muscle pain or joint pain. When you have a cold, if you go out and run for 10 minutes, if you notice your symptoms decrease, so headache, sore throat, coughing, sneezing, stuff like that, if it generally starts to get a little bit better at that 10 minutes or around that 10 minutes, then it's generally safe to keep running. However, on the other end of the spectrum, if those 10 minutes roll around and you're noticing symptoms get a little worse, so that headache gets a little bit worse, notice that you're coughing a lot more, other symptoms like that, then generally it's okay to stop running, because what's going on is when we're exercising, we're kind of taking a little bit away from our immune system and letting it do its job. So when we're exercising, we have that cold and it starts getting worse, then it's kind of taxing the immune system a little bit more and could generally exacerbate your cold. So that's kind of when you can tell if it's safe to keep running if you have a cold or you need to stop.
Hey, John, that's awesome. That's really good information. So
Nice.
if I start feeling worse after 10 minutes, I should stop running.
You should stop running.
Okay, and if
Yeah.
it feels a little bit better, or maybe the same, I should be okay to continue at
Mhm.
that time. Awesome, that's good
Yeah.
information. Cool, guys. I hope you all enjoyed the video. That's it for today. And then we'll be back next week. Join us. We'd like to talk a little bit more about some of the more common injuries that runners may experience. So thanks, guys.
Bye.